My talk today is about indications, complications, and preparations of blood transfusions. My name is Dr. Mayyada Ghannam, lecturer of Clinical Pathology Hematology Unit. Our learning outcomes are to know different components of donated blood, indications for transfusion of these blood components, preparations of blood components, and complications of blood transfusion. Blood transfusion is the injection of volume of obtained blood from a healthy person, which is called donor, into the circulation of a patient, which is called recipient, whose blood is deficient in quantity or quality. Donated blood is usually subjected to processing after it is collected and separated into blood components by differential centrifugation. Different blood components are whole blood, packed RBCs, platelets, fresh frozen plasma, cryoprecipitate, protein solution, factor concentrate, granulocyte concentration. The indications for transfusion of whole blood: stored whole blood at 4 Celsius centigrade for up to 35 days. Donor and recipient must be APO identical. Indications for transfusion of whole blood: hemorrhage, sudden loss of 25% or more of the whole blood volume. Patients undergo exchange transfusion. Bagged RBCs transfusion. The bagged RBCs stored at 4 Celsius centigrade for up to 42 days. 1 unit of bagged RBCs increase the level of hemoglobin by 1 gram per deciliter. Indications for bagged RBCs transfusion: symptomatic chronic anemia without hemorrhage, cardiac failure, acute blood loss for 30% or more of the whole blood volume. Platelet transfusion: stored platelet at up to 5 days at 20 to 24 Celsius centigrade, which is called room temperature. 1 unit per 10 kg of blood weight increase platelet count by 50,000. Indications for platelet transfusion: patients with thrombocytopenia or platelet function defect, correction of coagulation defect if platelet count less than 50,000 per milli. Fresh frozen plasma transfusion: the fresh frozen plasma bag stored up to 12 months at minus 18 degrees or colder. It is the supernatant liquid portion when fresh blood is centrifuged at 300 ReV per minute. Indications for fresh frozen plasma transfusion: deficiencies of coagulation factors, emergency treatment of vitamin K deficiency, treatment of TTP, treatment of DIC. Cryoprecipitate transfusion: prepared cryoprecipitate from precipitated form or collected when fresh frozen plasma is thawed at 4 Celsius centigrade. It is rich in factors 8 and 13, fibrinogen and von Willebrand factor. Indications: in cases of hemophilia, hypofibrinogenemia, von Willebrand disease, DIC, or disseminated intravascular coagulation. Complications of blood transfusion classified into acute transfusion reaction, which occurs within 24 hours after receiving blood or blood transfusion. Also sub-classified into immunologic reactions, non-immunologic reactions. The immunologic reactions are febrile non-hemolytic reaction, allergic reaction, hemolytic transfusion reaction, transfusion-related acute lung injury, which is called TRALI. Non-immunologic complications: bacterial contamination, transfusion-associated circulatory defect, acute hypotensive reaction, physical hemolysis in picture of hypothermia, hyperkalemia, and acidosis. Delayed transfusion reactions, which occur after 24 hours of receiving blood or blood transfusion, also subclassified into immunologic reactions, non-immunologic reactions. Immunologic reactions are delayed hemolytic transfusion reaction, post-transfusion thrombocytopenic purpura, alloimmunization, graft versus host disease, non-immunologic complications, which are iron overload وcitrate toxicity. Transfusion-related infections in form of viral hepatitis, malaria, syphilis, cytomegalovirus infection, and AIDS. Thank you for your great listening to my talk.